Hey everyone, Dr. Eric Jackson here. Wanted to sit down with you just briefly and talk a little bit about fruit juice. So when I speak to parent groups and whatnot, I often and almost inevitably get questions about how much fruit juice should I be giving my kid. It's an interesting, evolving concept because ultimately I know a lot of generations prior, fruit juice is healthy. Apple juice, orange juice especially, very common. But even all the other juicing, the juicing phenomenon, all the juicers of the 80s and whatnot. The problem though is that we've kind of gone in the opposite direction now. And let me tell you why. So specifically, I'm going to cite the June 2017 publication of Pediatrics. It's the official publication of the American Academy of Pediatrics, and they had a great article in there about this exact topic, and they gave great guidelines. So it was basically a guideline update. So the main concept I'm going to give you here is that you should eat your fruit, not drink it. Remember that. If you don't remember anything else, remember that one thing. Eat your fruit, don't drink it, because that's really quite good. Why would you want to do that? Eating your fruit will give you fiber. If you eat an orange versus drinking orange juice. Eating an orange will give you the fiber from the pulp. It'll give you, raw, brand new vitamin C, especially, and most importantly for the dental aspect, there will be no additional sugar introduced to that. I know there's other options out there now, especially in fruit juice. There's no sugar added, there's organic, there's a million different options. But really it comes down to the best way to control the added sugar is just to eat an orange. Or eat an apple. Also give your kid these things too. A nice little, those little cuties. My children love those little cutie, tiny, whether tangerines, clementines. I forget exactly what they are, but they're just basically the size of they're perfect. They sit in a kid's hand. They can peel them real easy. They are absolutely wonderful, and I like them a lot too. But if you're going to give your child juice, how much would you do? How much dosage would you give them, so to speak? Number one, for age brackets, that's how they split it up in this article. 0 to 1 years old, juice should not be introduced at all. So no juice until age 1. And that kind of makes sense because ultimately you're probably either breastfeeding or formula feeding. You want the child to have nutrition from those aspects, milk and water or formula being the top three. Once the child turns 1 year old, they are graduated up to a limit of 4 ounces of fruit juice daily for ages 1 to 3. So for the kind of toddler ages, they get to have a little bit. And then from ages 4 to 6, it goes up by a couple ounces. 4 to 6 years old gets 4 to 6 ounces. And I kind of like that because I don't know if they designed it properly as far as a mnemonic goes, but 4 to 6 years old, 4 to 6 ounces of juice. And then after that, 7 to 18 years old, which you might think, yes, 18 years old, because there is a tremendous amount of other intake issues we have here. Anything with a tremendous amount of sugar. We want a balanced diet, right? Medical doctors want a balanced diet. Dentists want a balanced diet. It's good for your body. It's good for your teeth. So if you're, 7 years old or 18 years old, and you're just guzzling down fruit juice, it's not going to go well for you either way. And frankly, you also can just apply that to adults. All the different smoothies. I know that it's finally come out that, for example, I guess I'll pick on Jamba Juice because it's the first one that comes to mind, but all these smoothie places and whatnot, we're all kind of touting healthy fruit this and get your fruit servings and that, but the amazing amount of sugar that's added to those is just absurd. And if you haven't looked into that, and if you're a big Jamba Juice or whatnot type, or those smoothie type of person, look into that. Look up the nutritional facts. I think you'll be floored with how much added sugar there is in these drinks. So for those 7, I kind of sidetracked there. Sorry, it's obviously not the first time. If you've been watching the videos, for those 7 to 18 years, we want to limit it to 8 ounces or a cup, of juice. Because ultimately, based on body size, obviously there's a big difference between 7 years old and 18 years old. But really, we're not dealing with a lot. And a juice glass, just to remind you, a juice glass is pretty small. It's not a giant water glass. A juice glass is always traditionally quite small, and that's a good reason for that. You don't need too much. So keep an eye on that volume, please. The article is wonderful. It also goes into a lot of other detail. I'll touch on a couple things here. It advises parents to avoid putting juice in the kid's sippy cup. Sippy cups are wonderful. I've got 4 children. We have hundreds of thousands of them laying around the house. But with that said, it gives the child the ability to sip on sugary drink at their leisure. We don't want that. Much like Halloween candy, and Halloween's coming up here in a couple of weeks, and we'll make a video about Halloween candy, but spoiler alert, the best candy for your teeth are candies that dissolve quickly, don't sit on the teeth very long. I always recommend, a classic being a Hershey bar, right? I actually love Hershey bars, they're very tasty, but we don't want the opposite. Oh, and I should say low acidity. We don't want the opposites, things that are always on your teeth with high acid. A sour atomic ball, suckers or whatnot, gummy suckers, that are always there and always bathed in the teeth in sugary, acidic danger, essentially. Same exact thing for the fruit juice. We don't want the child sipping on it daily, or worse, even worse, is at night in their crib, and we don't do that. Baby bottle tooth decay, if you're not familiar, a child should never go to bed with, I personally think never go to bed with a bottle. But if you're going to put a bottle with bed, it should have water in it. Water is pH balanced, and it helps to discourage acid and cavity production. So all those concepts are very intertwined yet separate. I'm sure, and if you like, let me know. If one of those piques your interest, put it in the comments below, and I'll make a whole video about it. Each of those is a long talk. One of the other things that popped up on here is also just a reminder for adults, children, and anybody in between, please don't take medicine with fruit juice. Your prescriptions, actually that's a pretty good advice also, but specifically grapefruit juice. It's in the medical and dental world pretty well known that we advise patients not to drink grapefruit juice along with their medicine. It's becoming more and more knowledgeable in the public, so I just want to make sure I mention that because that's part of the great article as well. Unpasteurized juice as well as mentioned. We are in the fall here, temperatures are dropping. We're going to start doing it in Chicagoland, in the Midwest, pumpkin picking, apple picking, there's cider involved, and unpasteurized cider is something that the article advises parents use caution about. They use the word strongly discouraged giving it to children. That's obviously, I don't tell people how to parent and whatnot, we advise, but unpasteurized, remember that it's just, there could be things in there, right? There could be bacteria and nasties in there. The young and the old are always at risk for the extremes. They're always at risk for contracting what the middle group, us healthy adults, probably wouldn't be affected by. So be careful if you're giving children or elderly, frankly, unpasteurized cider or juice or whatnot. And then finally it talks about if the child's sick, has diarrhea or needs a fluid replenishment, be very careful with how you're replenishing it. Just like with sports drinks, everything in moderation. I have no particular bone to pick with Gatorades and things like that, but you can't be sitting around sipping it all day long. The best possible thing to do is to drink it ideally in one sitting in a small amount of time, get it on the teeth, get it off the teeth, get it in the stomach. That's where it's going to do the best good anyways, and then it starts to rehydrate the body and you're in good shape. So I encourage you to all go to the I'll put the link in the description here, but I encourage you all to go to the June 27 publication of Pediatrics magazine, the official publication of the American Academy of Pediatrics. A fantastic reference as far as parenting guides. They do a tremendous job, obviously, over there, and a lot of it is very crossover with dentistry. If you've been watching the videos, especially recently, you'll know that one of the main pillars of my office, my philosophy as far as dentistry goes, is that dentistry and medicine have always been, but especially these days, are intertwined more than ever before. And you have to be knowledgeable about medicine, and as dentists, and medical doctors have to be knowledgeable about dentistry as medical doctors. And overall, I think that that's something that you're going to hear me drill home, because ultimately repetition is the key to learning, if you will. So check it out. Check out that that article. And as always, if you like this video, please give it a thumbs up. I'd love to hear any comments or read any comments below. We touched on a lot of little things here today, so if you want to hear more, yeah, tell me more about XYZ, or tell me more about ABC. Please put that down below. I would love to be able to know and deliver the content that you guys want. Until I talk to you again, have a great rest of your day, and all the best. Bye-bye now.